This is the Lifestyle and Weight Loss for Teens podcast. If you're a mom and want to help your child who is struggling to lose weight, you are in the right place. If you are looking for healthy lifestyle tips, Dr. Gourgari is here to help you understand the science around safe weight loss in teens and children. Because what works for adult weight loss is not always the best for children. This podcast is for educational purposes only. Dr. Gourgari does not provide medical, psychological, or nutrition therapy advice. You should not use this information to diagnose or treat any health problems without consulting your own medical practitioner. And now, your host, Dr. Jenny Gourgari.
Welcome to another episode of the Lifestyle and Weight Loss for Teens podcast. This is Dr. Jenny Gourgari, and today I'll be talking about A1C. Parents hear normal A1C and feel relieved. Okay, that's good. My teen is not at risk for diabetes. But as a pediatric endocrinologist, I can tell you that in teenagers, metabolic problems begins years before the A1C becomes abnormal. A teenager can have insulin resistance developing, high insulin levels, cravings, rapid weight gain, darkening around the neck and the axilla. They can have polycystic ovary syndrome, and the A1C can still look completely normal. Today, I want to explain why that happens, what A1C actually measures, what it misses in the teenagers, and other lab clues pediatric endocrinologists sometimes look when they're trying to catch metabolic problems early, because early identification is very important. You can prevent the future prediabetes, the future diabetes, and future complications. So that's what I help teenagers with. I help them improve their metabolic health through health habits, sleep, movement, nutrition, stress management, hormone education, without shame, without dieting, without restriction. And honestly, this topic today is one of the biggest misunderstandings I see in families, because many parents feel falsely reassured by one single lab value, the A1C. We call this hemoglobin A1C. I know most parents refer to it as A1C. So let me explain what is A1C. A1C, or hemoglobin A1C, or glycosylated hemoglobin. Hemoglobin is the protein inside the red blood cells in the body that carries oxygen. When there's a lot of glucose or sugar in the blood, the sugar attaches to hemoglobin. And the more sugar there is over time in the blood, the more the glucose sticks to the hemoglobin. It's called glycosylated hemoglobin. Red blood cells have a lifespan of around 3 months. That's why the A1C represents the average sugar in the body in the last 3 months. Is this the absolute test that cannot miss anything? No. A1C is one of the tools that can be used for screening for prediabetes in teenagers, along with fasting glucose and oral glucose tolerance tests. Oftentimes, the A1C can miss teenagers that have pre-diabetes. The A1C can underestimate the percentage of teenagers that have pre-diabetes and abnormal sugar. That's why when we have high concern that there are teenagers at high risk to develop prediabetes, we as pediatric endocrinologists may take one step further and we can do more tests. Puberty itself naturally increases insulin resistance. During puberty, insulin sensitivity can decrease by about 25 to 30%. And that means that teenage years are particularly vulnerable. If a teenager is overweight, the body is already stressed because of the extra weight, and then they go into puberty, they have more insulin resistance because of puberty. That can tip them off and become an A1C abnormal, or A1C looks okay. However, there could be other signs of insulin resistance and early signs of prediabetes before it becomes diabetes. A1C is kind of a late sign. There are other earlier signs that you can see before you get to see a high A1C. Because the first thing that happens is you start by having insulin resistance. You have high insulin levels to control the sugar to control whatever carbohydrates when you're eating. So that's like a compensatory hyperinsulinemia. And sometimes fasting insulin can help us get that additional piece of information. However, it's not routinely recommended to do a fasting insulin level. What are other clinical signs that are important when we have high suspicion? So if you have a teenager that they're gaining weight rapidly, they're always tired, even though they're sleeping, okay, they have a lot of stress in their life, you start to see that they have dark skin around the neck, under the axillary, or if it is a girl, you start to see acne and irregular periods. Or if you have teenagers that have family history of type 2 diabetes, or that you have a teenager that also has fatty liver disease, or a teenager that has PCOS, those are the teenagers that may be at higher risk for prediabetes. A pediatric endocrinologist may consider doing additional testing, even though the A1C may be normal. What are those additional tests? One is the fasting glucose, and then the other test is the 2-hour oral glucose tolerance test. If you're a mom and you've had that when you were pregnant, it's a test where we give teenagers to drink sugar, and then we measure the amount of sugar after 1 hour and 2 hours. And we look at the 2-hour sugar to see if there is abnormalities that indicate abnormal glucose tolerance. The problem with the oral glucose tolerance test is that drink does not taste good, because I did have that myself. Besides that, it is a time commitment. It's not an easy thing to do. It often requires that there is a nurse, somebody to supervise the test. It takes about 2 hours. It can be time consuming. It does not have the best reproducibility. So you can go and do the test, it can be normal, and then you can go and do the test again after 3 months, it can be abnormal. And that's why typically it's not like one of those tests that we do, and that's a discussion that you can have with a pediatric endocrinologist, and we decide on a one-to-one basis whether to do it. High suspicion cases in patients that have high risk for prediabetes, where there is a normal A1C, a pediatric endocrinologist may elect to do a glucose test along with a fasting glucose level. Now, I also want to mention, sometimes I see teenagers that are not at high risk for prediabetes, and they may have slightly higher A1C. This A1C can give you falsely elevated results. One very common reason why A1C can be abnormal is iron deficiency. If you have iron deficiency anemia, that can sometimes elevate the A1C without necessarily meaning that there is risk for prediabetes. Iron deficiency is very common, particularly among teenage girls that have heavy menstrual cycles and they're having rapid growth, or they're not eating enough food with enough iron. A1C can potentially miss early insulin resistance in prediabetes. Iron deficiency can falsely elevate a little bit the A1C. That's another thing you can have a discussion with your pediatric endocrinologist. Another thing that we look at is if there is a lot of triglyceride. We could do a fasting lipid profile. Triglycerides is another thing we get besides the cholesterol. HDL is the good cholesterol, LDL is the bad cholesterol. So if you have a higher triglycerides and a low HDL cholesterol, then that is also associated with insulin resistance. Now, this ratio is not diagnostic by itself, but it's a clues that the doctor can put together and see if there is metabolic dysregulation before you see the A1C. The labs by themselves are not determining whether a child has prediabetes or whether a child is at risk for prediabetes or not. That's why the role of pediatric endocrinologist, the role of pediatrician is very important. That your pediatrician can ask you all the questions, assess the risk factors, do the physical exam, and examine your teenagers. They can see whether they have other clinical signs of metabolic derangement. They can have other risk factors, and they can test those tests, and depending on those, they can decide what to do next. So the biggest takeaway that I want you to remember from this is a normal A1C does not always mean normal metabolic health in teenagers, particularly during puberty, and particularly the teenagers that are at high risk to have prediabetes. If you don't know if your teenager is at high risk, I have created the quiz. You can go to lifestyleforteens.com/quiz and get the quiz and see if your teenager is at high risk for diabetes. That's all I had for you today. I hope this was helpful, and I will talk to you next week. Take care. Bye.
If you enjoyed listening to this podcast, I invite you to come check out the LIFT program. It's Dr. Gourgari's 12-week coaching program for teens and their moms, where we take all this information, we apply it to your daily life, and we work together so your teenager learns how to create a healthy lifestyle so they can feel happier, more confident, less stressed, and love their body again. Visit the website at lifestyleforteens.com and click on the Work With Me and free resources to learn more about this program and get free help to start this journey right away. Thanks for tuning in, and we'll catch you in the next episode of Lifestyle and Weight Loss for Teens.